Hello, everyone, and welcome to our keynote panel discussion, Accelerating Access for All Through Sustainable Public and Private Partnerships. Everyone has just had lunch, so I see people are still coming in, but let's get started anyway. So every day, millions of people in low and middle income countries struggle to access the healthcare they need, and even more fall into poverty because they cannot afford the medical cost. So there's a huge need for investment to bridge the gap between healthcare needs and what's currently provided. The public sector cannot do this alone. Yesterday I was in a very inspiring workshop on innovative finance for maternal health, where I heard from Hatice Beton, who leads the G7, G20 Global Health and Development Partnership, that governments are so highly indebted that 50% of the people are actually working to pay off public debt. So where the government doesn't have the capacity, the private sector steps in and NGOs step in. And this is local private sector with health facilities, health centers, labs, pharmacies, and international private sector, and of course NGOs. And these are critical factors in making sure that everyone has access to care, but to date, many operate still in silos. So if you would just think that all the capacity, research capacity, service delivery capacity, supply chain, and funding, if this would actually be integrated and public, private, and NGO would work together, how much more you could achieve with the same amount of resources, cutting through inefficiencies and intransparencies that are now there and allowing actual scale-up of successful initiatives, because the public sector needs the private sector and vice versa. So today we have a very exciting panel of experts who each, in their own way, have pioneered public-private collaborations. They all hit their heads a couple of times, but they persevered and succeeded in the end. So what we're going to do today is the following. Because you may think, like, I just had lunch, it's warm here, I'm going to sit and doze off for a bit. But we don't want that. We want you to be engaged. So what we're going to do is we start with a quiz to set the scene and also to test a bit your knowledge on the topic. My biggest fear is that you know all the answers to the questions, so that's why we came up with a bonus question that I'm sure not everyone knows the answer to. But so that's how we're going to kick off. Then we're going to start with introducing our panelists and asking them questions up until about 3 o'clock. And then we'll open the floor to you guys, because as I said, we want you to be engaged, to ask questions and share ideas. I think two key questions will be critical today. One is, what have we learned from public-private collaborations to date? What were the major pitfalls? What were the key parameters that made them successful? But secondly, also, how can we use those learnings to scale them? And what is the role of innovative finance in this, right? Because public sector finance is not going to cut it. Investments, private return-seeking capital in healthcare solutions for the broader population, the base of the pyramid currently still is insufficient. So also there, how can the public sector and private sector, so guarantees, first loss, concessional financing of the public sector, help to mobilize more private capital into solutions that benefit all. So let's start with the quiz. So my first fear is that you know the answer to all the questions, and the second one is that the technology is going to fail us. But, so the idea is you scan the QR code, and then you get a chance to change the name that's been given to you, but the names are actually quite interesting. I think they're like Perseverant Falcon, or Exploring Duck, or Conquering some other rabbit. But if you really want your own name to be on it, you can change it. And then we can start. It's multiple choice, so the one who wins is the one who has the right answer, but also the fastest answer. And actually, there's a winner for each question, so that gives more of you the chance of eternal fame. So let's start with question one. According to the World Bank, OECD member countries have on average 5.1 hospital beds per 1,000 people in 2018. Do you know how many hospital beds per 1,000 people there are in low and middle income countries. And this is an average, right? So in many low income countries, it's even much lower. Is it 5.1, 4.7, 1.2, or 2.3? You have 30 seconds. Well, it turns out that you don't know all the answers. That's a good one. But the one, who won? Oh, there we go. Proactive, so placid duck, yeah, that's what I thought. Yeah, so eternal fame, it's actually 2.3. It's an average, right? So it's also middle income countries, but that shows really the investment need in infrastructure in lower and middle income countries in health. So let's get on to question number 2. Yeah, you have to scan it again. This is really to keep you awake, right? So you have to persevere and come up with another. Non-communicable diseases kill 41 million people each year, according to WHO, equivalent to 74% of all deaths globally. Do you know what percentage of NCD deaths occur in low and middle income countries? Is it 10? Is it 30? Is it 50? Or is it 80? It's above the infectious disease burden, of course. Oh, we still have 2 seconds. There we go. Yes, you're right. It's 80%. Just imagine there are more NCD deaths in lower and middle income countries than in OECD countries, on top of this huge infectious disease burden. Question, let's see, who wins? Diplomatic eagle, intuitive parrot, the good pigeon. The good pigeon. Well, eternal fame for the, I don't know if you even know what your...
Gentle swan. Gentle swan.
Oh, the gentle swan. Yeah, of course. That's sure. Poetic name. Well, congratulations. Let's go to the third question. In 2019, scientists at WHO estimated that among 67 low-income countries and middle-income countries, representing almost all the population, 95%, the annual financing gap in US dollars to reach the SDG health target is it 800 million? Is it 26 billion? 370 billion or 12 trillion? And this is annual, so it's not accumulative, but it's annual for these 67 lower and middle income countries. What is it? Is it A, B, C, or D? Well, you were right. Yeah, you actually are very smart. Of course, I'm preaching here to the experts, so it's just a tricky one. 370 billion a year, which is pretty, it's pretty massive, right? 370 billion a year is needed to bridge the health financing gap in lower and middle income countries. Who is the amiable falcon? Wow, congratulations, eternal fame for the falcon. So, just if you look at this huge need, and you look at what governments can provide, so that's what question 4 is about. I think we have to get on to the next question. Yeah, another. According to WHO, the Global Health Expenditure Database, domestic general government health expenditure accounts for 9.2% of GDP in high-income countries. What's the average health spending as a share of GDP in lower and middle-income countries? Is it 8%? Almost 1, 5, or 3. And again, this is a mixed bag, right? It's an average of the lowest income countries and middle income countries combined. So what will it be? Wow, you guys are really good. Look at this. 43% had the right answer. 3%. So that's 1/3 of the percentage of public health expenditure in high-income countries. So the burden is much bigger, the need is much higher, but as we said, the governments just do not have the capacity to fill this need. The thoughtful pigeon. Congratulations. So if we look at this shortage, and this is already in line with the introduction, right? Another QR code scanning. As we say, health is a semi-public good, right? what is the approximate proportion of people in lower or middle income countries who seek healthcare services in the private sector? So we'll go to private primary healthcare centers, radiology, hospitals, pharmacies. What's the percentage? Is it 10 to 20, 20 to 30, 30 to 50, or 50 to 70? And it is. Ooh, this was a close call, eh? But you guys just beat it. It's 50 to 70%. Just imagine, that's a lot, right? And it's very much in line with, with the private sector filling the gaps, right? So the first place is for philosophical duck. I'm curious who that is. Oh, congratulations. So if you think that this is the status, right? So people turn to the private sector because the public sectors do not have the capacity to serve everyone. You would think that investments in private health facilities or in public health would be, it's a no-brainer, right? Investing in health, it generates social returns, it's human development, economic development. I think the return on investment of investing in vaccinations is 1 in 44. Primary health, I think 1 in 11. So it's a no-brainer. So you think the investments, the impact investments in health in lower middle income countries would be massive. What do you think is the percentage of assets under management, so the market value of the investments managed by a fund or another entity, allocated to health in emerging markets? Is it 20%? Is it 4%? Is it 12 or is it 25? What do you think? There we go. We have 5 more seconds. It's 4%. Yeah, that's pretty shocking, right? If you think of the need and the returns that can be achieved. The understanding dove is doing really well. But who? The conscientious pigeon. There's lots of pigeons winning this. It's a great job. I thought pigeons were not so smart, but apparently they are. So great job. But just for the sake of it, because I really like the bonus question, shall we? I'm just really curious to hear if you're also, which one of the, oh no, I mean the other one, the next one. Okay, well, this one is interesting too. Which one of the following diseases was declared a pandemic by WHO in 2012? And it's really true, of course.
3.
Already in 2012. Is it disease, well, disease X? Hemorrhagic fever? It's physical inactivity, indeed. So I think maybe that if I see you guys falling asleep or dozing off, maybe we should have a bit of an intermezzo in between where we stretch our legs and get the blood flowing, right? So this one was a no-brainer, of course. And prevention is key. The Sanofi falcon. The skeptical seal. Again, a philosophical duck. That, yeah, I think that's the winner. Eternal fame. So maybe we should go on to the serious stuff now, but this is, of course, a bit of a playful quiz to keep you awake and to get you interested, but it is quite shocking to see the huge investment need that is there and the lack of funding, basically. The huge share that the private sector takes in providing healthcare also to lower income populations and at the base of the pyramid in lower middle income countries, but then also this lack of investment. So it's quite shocking and appalling to see that this still is the current state of affairs, and everyone talks about impact investing in health and public-private partnerships, but it's still insufficient. But luckily today we have a very inspiring panel. It's a unique mix of public sector, of private sector, both local entrepreneurs and international private sector, impact investment, and NGOs who have made public-private collaboration their core business. It's not greenwashing, but they're highly committed and have been in this space for a very long time already. Have hit their heads many times, but have persevered and have shown quite some successes. So today we'll hear from them what their experiences have been, what were these pitfalls, what were the critical success factors, but also how can we, going forward, how can we take these learnings and move beyond fragmentation and pilots and small projects in single countries, but actually implement public-private collaboration at scale, because we need both the capacity, research capacity, implementation capacity, and funding from the private sector and the public sector if we want to accelerate access to care and achieve SDG 3. So we'll look at implementation, at research, but also at financing. How can these partnerships, the blended finance partnerships, be established? So without further ado, I'll just say the names of our panelists, and then when we ask the first question, then they'll get a chance to introduce themselves. So we have Sami Amar. He's the head of global health at Save the Children UK. Noella Birigamana, she is the deputy director general of the Rwanda Biomedical Center. John Ferrest, head of global health at Sanofi. Farouk Merali, who is the CEO of Swipe RX. And Ilka Wicke, who is the head of Making More Health at Boehringer Ingelheim. Welcome. Round of applause. And let's see. So the first question, as I said, will center around how can the public and private sectors collaborate more efficiently, and what are the learnings from your experience? So let's start with you, Sami. What can the private sector bring to enhance your work in resource-restricted settings? And can you give some examples of how this has been successful?
Sure. Thank you very much, Femke. Thank you all for being here. I'm delighted to be here. It's my first World Health Summit. Very excited. So I'm Sami Amar. I'm head of the Global Health Department in Save the Children UK. So I'm part of kind of a global child rights organization, which I'm sure many of you are familiar with. That engages in lots of different areas of global health. And we, as an organization, I think it's fair to say, generally believe in the power of public-private NGO partnerships in furthering global health goals. And I think we've probably been ahead of the curve in our sectors in kind of being quite ambitious in our partnerships with the private sector, firmly believing that essentially we cannot achieve the SDGs without the public, the private sector, and a much stronger civil society. And we have to kind of move forward together. I suppose my line of thought and the argument that I'll be taking throughout this session is that public-private partnerships are potentially great, but public-private and NGO partnerships are even better. I think tripartite partnerships that include civil society right from the start, I think are incredibly powerful and can potentially solve problems that public-private partnerships alone cannot even see. And that would be, our experience as an organization, simply because, we all have blind spots. Everyone. We NGOs have blind spots. Governments also have blind spots because they rely heavily on data. They are kind of data-driven organizations, and let's face it, data on the very complex social, behavioral, environmental determinants of under access to essential health services is scarce in many parts of the world. And so you don't know what you don't know. The private sector also has blind spots, obviously. Private sector organizations very understandably look for markets, and it's sometimes difficult to find a market in very low resource settings. And so the job that I think civil society can play is kind of flagging issues that are off the radar and could save hundreds of thousands, if not millions, of lives. And so, access isn't a given. And this is something that I heard actually this morning. The CEO of the Access to Medicine Foundation, Jay, I think said that less than 1% of people generally have access to newly introduced product or therapeutic, which I think is really interesting metric. So I'd like to maybe talk about one example, which I think is really powerful, of something that we in Save the Children have been involved with over the last 5-6 years. And so many of you will probably know that umbilical cord care is really important for kind of newborn babies. The umbilical cord can be an entry point for bacterial infection and kind of cause newborn sepsis, and is responsible for lots of newborn deaths around the world. The government of Kenya expressed a strong interest about 8-9 years ago in introducing chlorhexidine. And the chlorhexidine, either solution or gel formulation, that could be used very easily by healthcare workers and mothers and community health workers as well, to treat umbilical cord care. Now, there was a complete lack of engagement from national manufacturing companies. GSK at the time, and they've been a corporate partner of us for many years, stepped in and kind of reformulated an existing product, because they had already a lot of experience with that molecule, and repurposed it into a gel formulation. So together with their kind of R&D, research, manufacturing capacity, with the government of Kenya, the Ministry of Health, as well as the county health directors of Bungoma and Busia counties, we sort of stepped in as an NGO partner, saying, hang on, if you're going to do this, let's do it right, and let's think about access. And so what we did was kind of to co-lead a managed access program, essentially gathering lots and lots of data around the acceptability, the affordability of that product. And this partnership was key in finding out that kind of 97% of mothers who had given birth recently found this kind of new gel formulation useful, easy to use, that they would prefer to use that rather than traditional methods such as cow dung and others that had been used in potentially very harmful methods. And so this kind of journey that we went on together, and which later on kind of AMREF and PATH also joined forces with, ultimately led to the inclusion of chlorhexidine in the national essential medicine list, as well as the county level essential medicine list. And we've reached a situation where now kind of nearly 70% of newborn babies are being treated with chlorhexidine. So this is typically an example of a very successful tripartite relationship. None of this could have happened without that kind of three-way relationship. And government leadership is always incredibly important, but I'm sure we'll come back to that in a minute.
Well, thank you so much. This is a really impressive story. And yeah, thank you so much. I realize now that I never introduced myself. I think I wanted to get into the quiz so badly that I forgot all about that. So I'm Femke Smeets. I'm a partner at Total Impact Capital, a boutique impact first advisory and fund management firm with a strong focus on health in Africa and Latin America. And I'm really excited to be asking you guys questions, and especially listening to your answers and taking this quiz with you, obviously. Noella, we've had a prep call where I think that what you said was so critical, and it would be great if you share this with the audience here. Like, from your perspective, if government leadership is key, as you said. So what needs to be in place for you to sustainably and structurally work with the private sector? So can you explain to us how ideally a process looks like and what the critical parameters are?
Thank you, Femke. It's an absolute pleasure to be joining you this afternoon. So I'm from the Rwanda Biomedical Center. We are the National Public Health Agency, but we also have a strong mandate on the health research. So think of a CDC meets NIH, and that's what our institutions does. So in terms of the role of, again, as a government agency, the number one thing is, especially what's most relevant to the audience today, is we start with an issue, a gap that we have. And the gap is improving access to healthcare. And that's our primary focus. And what brings us here is to explore this approach of working with, as a public sector, of working with the non-public sector, or whether it's the private industry players or NGOs, as we just heard. And this approach is quite important because each and everyone in the room here, to an extent, are contributing to reducing gaps in healthcare. So we are here to ask, how do we break these silos? And what I hope is, and I have my notebook so that I can learn from you and from colleagues here on the panel. Specifically, again, from a public sector perspective, when you think of that approach, we know no single player can do it alone. We can't do it alone. So that's the point where we start. So as we go from this issue to the potential approaches, we know that there are solutions that have been identified. Sami, you just mentioned a type of solution that was able to be scaled. And what's important is to say who in the room can come together and work on scaling these potential solutions. And of course, as a public sector, we're always open to hear who can help, who can work with us on scaling these solutions. In particular, maybe to answer your question, Femke, the number one thing that we do is we look at, can this improve patient outcomes? And that's where we start, with any collaborator, including the private sector. And so when we looked at this, any collaboration with the private sector, or NGO has to help us towards reducing this gap. So that's the number one thing. We're answerable to the citizens. So I think that's an important role that we have to take up in any of the partnerships. Maybe if I make this tangible, one of the partners we work with here on the panel is Sanofi in the Global Health Unit. And I remember in 2022 is when I was first introduced to the group. And it started with the partner in question sort of asking us as a private sector, as a public sector, what are the top challenges that you have? That's very, very important in agenda setting, starting with what are the top priorities that the government has identified, or at least the public sector has identified. And that's where we started. And we listed, the needs are always huge. And we listed the top priorities based on the burden. And so we zoomed in on 4 components, one being cardiovascular, cardiometabolic diseases, but with an angle towards building community awareness, because we have built a strong foundation in the country. So community awareness, being able to have this prevention and early diagnosis for cardiometabolic diseases. The second component is oncology training, because you have to work with the skilled workforce, and we know non-communicable diseases are increasing in terms of burden, so that's a priority that we picked. Another priority was a stronger interest that was coming up in terms of clinical research, because we want to be part of the development of products, of vaccines, of diagnostics and therapeutics. And there's also a component of access to medicines, because ultimately everything we do is from that angle. So hopefully I've answered your question. You have to be working with the public sector to look at which priorities they are. And from our perspective, when we work, at least the partnerships that have worked are also focused on equity, right? If we're going to be collaborating, how is this helping to bridge the last mile? How is this helping to address gaps that are in the underserved population? So these are some of the criteria that we've worked on and that have basically helped us scale the solutions that have been identified.
Thank you very much. So yeah, I'm hearing a lot of good stuff. So government priorities should be leading, right? There's so many initiatives and there's so many pilots, right? But it only leads to more fragmentation and inefficient use of funds and of capacity and of expertise. So government priorities should be leading. And what I also hear is that it's not just funding, it's very much the expertise that especially international private sector can bring that can support the goals of the government as set by the government, right? So thank you very much. Well, John, you've been around the block for a while, not insinuating that you're old, of course, but as Director of Africa, now the head of the Global Health Unit, can you share with your experiences of the kind of public-private partnerships you've been in, where you hit your head and what in the end proved to be successful and why?
I haven't been around the block that many years. I just want to make that a point.
It's like 5.
No, but thank you all for being here. I'm John Ferrist. I'm head of Sanofi's Global Health Unit, and we work in 40 of the most underserved population countries in terms of healthcare across the globe, and we're providing 30 essential medicines across cardiovascular disease, diabetes and oncology. But we also have an impact investing fund around startups, so we want to help startups in the healthcare system to also accelerate in what they're doing. I'll come on to that in a bit more in a moment. But I think what's fascinating about this panel is that I think if we're going to sit down and handle some health issues, you need a group of people like this around the table before you start. Because, and Noella, thank you for giving me a great starting point here, because one of the things we learned very quickly sitting down in the countries was you have to align yourself with a strategic plan of a Ministry of Health and a government on what they're doing and where they're going and what the needs are, as you've said. And once you can identify truly what those needs gaps are, you can break it down into bite-sized chunks and start to think about what actors you need to bring to the table for that. And this is around sustainable approach as well. It's all very well to give grants or lump sums of money and pump them into a system and watch it disappear. I think everything we want to do now, and I think everything that we're talking about here at this conference is about how do we build something that's sustainable for the future so we have a real legacy that moves the dial on healthcare. And the way you have to do that is with partners. And Femke, you've said it very, very well. There's a lot of work going on out there. There's quite a lot of inefficiency. But when you sit down and you target around particular patient populations, around capability building, particularly down at local level, then how do you do that and how do you bring it into place? And I think this is where we need NGOs. We certainly need NGOs. We need foundations who have connections on the ground. They have the ability to reach the communities and upskill the healthcare workers. Remember, a lot of community healthcare workers in these countries are not even medical professionals. So we're starting from a basic thing, but we can do an awful lot. We need to do an awful lot around the building of capabilities at hospital level and increasing the number of specialists. And again, that's where we can work with faculties and we can work with universities in the countries, but we can take faculties from our more developed markets to educate groups of professionals and use a train-the-trainer approach. This is really crucially important. And we have to partner in the industry. And I think this is something where we all have our disease expertise, we all have our own programs, but finally we need to start sitting around tables together and not competing, but showing that we're going to work on real healthcare issues together. And the other piece of that jigsaw, and I'm looking at Farouk here, is we've got to look at what is in, if I take the African continent as an example, having been involved in the African continent for about 10 years now, the level of innovation and entrepreneurship is mind-blowing. And the level of opportunities to invest in is mind-blowing. And many of you will probably be surprised, but probably not this audience, but other people we speak to, about digital capabilities. And I would say that many of the entrepreneurs we meet also have a vocation because they've been hit by some tragedy because of lack of healthcare in their system. And when we sit down with these people, they quite often have a golden nugget of an opportunity to help healthcare delivery. And if we can invest in that as partners, if we can invest in that to get them from either a seed organization, a start organization to acceleration, and plug them into this network of working with an NGO, working with a government, working with the industry, we can accelerate skill sets, we can accelerate healthcare delivery, and we can truly make a difference. So this public-private piece has to start there, but it starts at the very beginning with sitting down and looking at the objectives and the targets as well. And Noelle, you said this really well. What are we actually going to achieve? Let's put something on the table that we can make happen, and we can measure it. And then we can encourage more investment because we can show a return for investment in what we're doing. And I think if you ask a question, that's probably one of the hardest things to measure at the moment, is if I put a dollar, a euro, or a pound in somewhere, what does it mean in terms of changing the dial in healthcare? And that's something I'd like us to have more expertise and dialogue on how we measure that, because trust me, when you see the difference it makes, you'll get much more investment flowing in to what we're trying to achieve.
Very true. Thank you so much, John. And this is a nice, interesting question also for the audience, so keep that in mind once we open the floor, because you may have some good ideas, because it is extremely impactful, but at the same time a difficult to measure, especially in the short term, right? What the actual outcomes and the impacts are of the investment that you make. But I'm also going to take note of the not competing. So it's a good one. Thank you. Thank you so much, John. Farouk, well, we've learned in the quiz that, well, more than 50% of the people turn to the private sector for health, and many of them go to pharmacies, right? Private pharmacies in Asia, Africa, Latin America. You can explain your extremely impressive story on what SwipeRx does, but can you also explain to us how, not only for directly for patients, but also for governments, what you're basically offering them in terms of enhanced scope of their, enhanced reach of their services?
Sure. Thanks, Femke. So good afternoon, everyone. So I think, let me take you on a little journey to Southeast Asia and set a little bit of the scene. So imagine across Southeast Asia, more than 80% of the pharmacies are actually independent mom and pop pharmacies. In Jakarta, Indonesia, the country of Indonesia has around 92% independent pharmacies. So when you look at this, you look at a situation where pharmacies are very sort of widespread, but they also function as the primary care point for the communities that they serve. And what we found out was that patients will visit a pharmacy almost 12 times a year, but a doctor only 1.2 times a year. So they become this very sort of critical point of care delivery in their communities. But as I mentioned, the problem is fragmentation, all these small mom and pop shops everywhere. And how do you actually bring them together to solve the problem of providing care for the end community? So what we do at SwipeRx is we connect all these independent pharmacies together. In fact, we connect about 50,000 pharmacies across Southeast Asia. About a third of all pharmacists in the region are on our platform. And we help to improve the quality of care by providing access to education, information, to improve the quality of care so that the pharmacist is well equipped to consult the patient. We improve the availability of medicine by creating group purchasing to lower the price and provide finance and credit to pharmacies to be able to actually make sure that product is on shelf for the end pharmacy. And finally, we help in affordability, really, to make sure that the prices are actually, affordable to the end patient. And so when we take a step back, this problem of fragmentation in the private sector affects, millions and millions of patients. And so we like to solve what are called common denominator problems. This problem of fragmentation is an issue that affects not only the private sector, whether you are a pharmaceutical company looking to improve access and distribution, but you are also solving a problem for governments on some of their national health programs. So what we do is we work with both, because the problem that we're solving is a common denominator problem, which is, we may work with a pharma company who is working on a commercially relevant disease like an NCD, diabetes, hypertension, so on. But when it comes to the remit of the public health sector, working on things like tuberculosis or maternal child health or COVID-19, they also need access to the pharmacy. So I think what we've been able to do is, by solving a common denominator, solve for something that isn't just relevant to just the private sector, isn't just relevant to the public sector, but is valuable to both, right? And I think that's an example of how you are solving these problems and then bringing collaborators together and building also a business model that isn't reliant on one or the other, that actually you can build something that does public health good by solving sort of this common problem.
Thank you so much. Ilka, you're making more health is such a comprehensive mix of initiatives, stimulating entrepreneurship. What is your vision on public-private partnership, and can you explain a bit what Björn Ingelheim's initiatives are to accomplish this mission?
Yes, happy to. It's really a pleasure being here. So Ilka Wicke, Head of Sustainability Social, and it was already mentioned, we have, with Making More Health, one of our key initiatives, we have a long-term history of more than 13 years working with underserved communities, really on the ground, building up Making More Health houses, really understanding what their needs are and how we can empower them on what they need, to working with social entrepreneurs globally in collaboration with Ashoka, and recently evolved our initiatives to the social business sector, supporting social startups in Sub-Saharan Africa up to social investments. Everything we do is, of course, focused and targeted to support, to address health inequalities and improve the impact, deliver impact on humans and animals in underserved communities. And it has been, a lot already has been mentioned, on social entrepreneurship, on social startups, and of course, as a global pharmaceutical company, we do embark on, I would say, the broader flagship public-private partnerships with many partners on the table, be it NCD Alliance, or Last Mile. What inspired us a lot, and I think John already mentioned, is working with social startups. And the interesting part, when you got started approximately 2 years ago, our focus was on supporting social startups with impactful business models to catalyze, basically, the impact they can deliver by supporting them, growing them, offering technical expertise, and of course, the so much needed funding. But from a more focused approach, we were really inspired to see if we are able to bring a portfolio of companies, of players together, how much they can complement each other and start to collaborate with each other and basically multiply the impact they could deliver with the one business model they are basically pursuing. So I'll give you a bit of a tangible example. We helped to bring a small alliance together with 3 social startups on delivering healthcare education by a hub and spokes model in a way that healthcare workers, basically on the ground in underserved communities, could be trained and upskilled to address the needs there. And just by supporting this complementary partnership, from healthcare workers to maternity clinics to diagnostic healthcare tools, we have been able within a year or two to support more than 100,000 patients or people on the ground, and train more than 1,200 healthcare workers and experts. So that's a nice example. And another one nice example, before we should go on to the next question, is basically a social startup in the animal health space we invested into in Ghana. And we brought them together with what I think a very innovative delivery technology, because they delivered animal health product to the last mile, which is a tremendous challenge to get there. So they teamed up with another startup, actually our colleagues from Middle East got to know, and started to deliver drone-based. So they now can access basically the last mile by just putting the animal health products on drones. And now nearly 100% of their delivery occurs by drones. That, and now the connection to the communities is made, was realized in a campaign we are running, which is addressing rabies. You might know, it was not on the quiz, but every 9 minutes people die of rabies. So most of them are kids. So we address the challenge of eliminate rabies in the communities we serve and support, and started to deliver the vaccines by drones. And not only drones, we also needed a cold chain, and that was another startup of ours. So combining these dots, and in the case of rabies, also engaging with the government, in that case local government, brought really tremendous value to those people who need it most. And these are for us some really tangible examples which we are definitely pay more attention to, and will for sure be growing in the future.
Thank you so much. It's, I think it's very exciting to see how, because indeed there is so much going on and there's so many interesting startups and super talented founders and great plans and how pharma companies like Boehringer Ingelheim, but also Sanofi are moving into the space where you're not giving grants, but you're actually investing investment capital, and not just that, but providing your expertise to nourish the growth of these companies, right? And I find it also very, very, very inspiring and necessary to hear you say, Farouk, that to be able to grow, you also need to combine both revenue streams, right? It's not just private sector, because in the end, if you want to scale, it will have to go through the public sector, right? So combining this is fascinating, and I think it's a nice segue to the next question, because it's inspiring to hear. At the same time, these are projects, right? And it would be so much more powerful if indeed this would be these resources would be combined, right? So we're not talking about some success stories that we're talking about here now in a panel discussion, but actually successful initiatives and successful enterprises can be scaled across countries and also across borders. And for that, there needs to be a more integrated approach. So I think that's had to cut through inefficiencies and break through those silos that still are there in all of the countries that you work in, right? So it's a nice segue to the next question, and we need to be a bit faster with the answers, because at around 3 we have 15 minutes to open the floor to ideas and suggestions, and so keep John's question in mind, and questions from the audience. So question, John, maybe start with you. How do you think these successful partnerships can be sustained and scaled in line with what I was just saying? And what kind of financing models, beyond what you're doing already now as a pharma company and impact first investor, which finance models can facilitate the scale up? Because we know that public financing is not going to cut it, and private return-seeking capital is often still quite shy and risk-averse, and doesn't step into this space enough.
No, and I think you know, in the current world, it's very tough in terms of financing in general. And you know, we've come out of a pandemic, which we can say many people say we're still paying for, but you know, we're sitting there with other pandemics. NCDs are a pandemic in themselves, and that's because that's grown over time. No one's looked at it as a sudden emergency, but it really is an emergency now. And I think we have to turn the thinking about investing behind this as something that is a greater good, not only for healthcare, but for the economies globally. And that's one of the first steps that I hope events like this can get these things back on the agenda, where we look at financing organizations, whether you be a bank, a foundation, an entrepreneur, a pharma company, a government. It doesn't really matter. It's how we get these topics back on the agenda as a good investment for the future. They have to be sustainable as well. You know, it's all very well building a new healthcare infrastructure and saying, off you go, everything's perfect now. But if it's not sustainable to be funded in the future, then it is a real issue. And I think this is where it comes back to the measurement piece. We have to show very quickly, for any finance mechanism we have, that investment is giving a return. And Noel, I think you said it. You know, you said it really well. What is where are we trying to get to, and what are we going to do? And when we make those milestones, you can add further. Ilka, I think your point is crucial. You know, we need to sit together and look at this scaling up approach. You know, when we look at investing in entrepreneurs, why don't we do more of it together? When we look at investing in healthcare infrastructures in countries, we should bring groups of people together around a table that can scale this up, because good models should be invested in more efficiently by groups of people. And you know, it's again having skin in the game. It's again looking at those outcomes of what you want, impact measurement, and ensuring that we have a sustainable financial plan for the future. So when people commit, it's not a one-off shot. It's something that, whichever mechanism we use, whether it be an NGO, a foundation, a company, that we can continue that, because you know, stopping halfway through is not an option. It's really not an option. And maybe I'll stop there, because I can probably talk too much about this and get too passionate.
So Farouk, maybe can you share with us your experience in how also finance partnership, blended finance partnerships can be very successful in nourishing the growth of your company.
Sure, happy to. So maybe I'll just share a little bit about when I was 17 years old, and I was a very idealistic, optimistic person. I've since then become realistic and jaded, but at that time I was very idealistic and optimistic, and I started a NGO, a nonprofit that was working in the global health space. And you know, I learned every single year how difficult it was to scale. There was so much, you know, ambition to grow and to scale, but every year we would open our hands and wait for donations and charity. And while that organization has still grown and it does great work, it will never be truly big. And every year you will always be compromised by the amount of donations that you can raise. So when founding SwipeRx, the idea was how could you solve something that actually is a commercial model first, but that you can attract other sorts of capital that allow you to do these big audacious goals, right? And I think that was really fundamental to constructing it. And it started with the problem, as mentioned, a common denominator problem that could attract capital from both the private and public sector to do things that were relevant to both. And so the other thing kind of, you know, noticed as an entrepreneur was that most startups fail. More than 90% fail. And even though startups are very glamorized, it's brutal, right? And that's what it is. And for healthcare startups, it's even higher. So you really have to realize that, you know, you have to build a fundamentals business. You have to be able to attract private sector capital. You have to attract public sector capital if that is your intention to create something that does impact, which was certainly mine. And you have to have patient capital, which both of these types of capital can be. And generally, healthcare startups take a very long time to realize that. So, you know, what we ended up doing was being able to pull from Silicon Valley investors. We were able to pull from, you know, NGOs and foundations like the Gates Foundation. We were able to pull from pharmaceutical companies and industry partners. And so very much along our journey, we were able to mix the capital types. And that's very important because the survival rate is very low and the length of time to succeed is very long. And so you need to be able to have these different capital sources to endure. So I think what's very encouraging is on this panel today, that is really a very good sort of example of how these different capital sources are all coming together to support startups longer term so that they can increase their survival rate and therefore their ability to impact patient outcomes.
Well, thank you so much. And as we heard, there's a willingness to think about these things, right? So yeah, scale up. So thank you so much. Semi, what is your take on how, because I think you showed us already how public-private partnership has been successful in scaling up at the country level, right? So what is your take on how you can scale successful initiatives even further, and what should be in place to accomplish that?
Right. I mean, it's a huge question, and I'm not going to delve too deep into the financing mechanism because it's not my area of expertise. And as an organization, we rely on lots of institutional funding, corporate funding. We engage with kind of development impact bonds as well. So we engage quite a lot with kind of various innovative financing mechanisms, but it's definitely not my area of expertise. So I'll let my colleagues kind of step in later on in that space. I suppose for me, the critical success factors from the really successful three-way partnerships that we have been involved in and those that we have not been involved in but that I've seen succeed, for example, with Cola Life in Zambia, which I'm happy to talk about as another example, is there's a few critical success factors, right? One is transparency. I think really important that everyone is absolutely clear about their objectives and what they want to achieve through this, and they come together in a spirit of kind of transparency and collaboration. It's perfectly natural for kind of a national manufacturing firm to want to make money. It just needs to be clear at the outset. Humility, and Noella touched on that already, really, really important. Be humble, recognizing that we are dealing with protracted health issues. The lower-hanging fruits of global health have already been harvested. What we're dealing with now is systemic, it's difficult, it's all about the social and behavioral determinants of health. It's complex stuff, and if it hasn't been resolved, there's a reason for that. So yeah, come at it from a really humble perspective and kind of mutual learning perspective. Having an exit strategy and a scale-up plan is also really important. In the example that I cited earlier, for example, around chlorhexidine, 2021, GSK discontinued the production of their Umbipro product. At the moment, there were enough national manufacturers of similar type products at a lower cost. That was it, and that was the end of their contribution. And the new phase of that scale-up plan and kind of national coverage expansion started. So I think having that at the outset, really, really important. Strong government leadership. I mean, I know we love talking about kind of equal partnerships and shared value partnerships, and it's really important, but there's no such thing as an equal partnership in that situation. I think it's absolutely critical that the government is the senior partner in that partnership and the engine. Otherwise, it doesn't work and it's not sustainable. So I think really, really fundamental. And actually, the availability of fiscal space. It's not as simple as the private sector coming in to replace the public sector when it's not delivering. It's not as simple as that. And actually, research has shown that the most successful public-private civil society partnerships have taken place where there is sufficient fiscal space to direct these investments in the right place and with the maximum benefit for underserved populations. So let's not make that mistake. And I think a last point that I would make, and I think that's just a psychological barrier that I see time and time again in the way we talk about health in global fora, is we still talk about health and health services and health delivery as a cost and not an investment. And I think to speak to John's point around the dearth of investment and money, I think a lot of it comes back to that, seeing health as a cost, not an investment. And I think it's up to us to kind of change that narrative.
Here, here. Thanks so much. So, Noella, also listening to what everyone's saying and what Sammy is saying, what does Rwanda need going forward? And you've shown how government leadership can make these partnerships really successful. Can you share with us your future vision for Rwanda in public-private partnerships?
So thank you. We've been accused as government agencies to have a short attention span. So many issues, and so we have to be, like we just heard, these are complex issues we are dealing with. And so to your point about being a senior partner, in answering, you know, we are answerable to the citizens as well. So that's where I want to start with. So I hope everyone here, and I know that's the common denominator that we have, is that we are here to address gaps that have been identified in terms of access to healthcare. So I think with these complex issues that we are dealing with, again, from a public sector perspective, is, you know, we have to be systematic in the way we approach these challenges. We know we can't, you know, which is what I started by saying, we can't work on it alone. And so we are hearing examples from this panel of various ways that the collaboration can work. So hopefully you don't exit this room as you entered it, and it gets you thinking around, you know, let's not have these, you know, big words and not, you know, being subsistent in our approach. So one example I would say, when we started, you know, when we start to work with a collaborator like Sanofi, so you start with a list of potential areas that are complex issues, and then you zoom in on, you know, levers and projects that can work and be scaled. In terms of, you know, how do we measure it as well, that has to come in. So let's say skill set. Skill set is important. We know that we want a workforce that is highly skilled. And so we started by saying, okay, how will we measure what we've been able to achieve? And so I know that over the next 2 years, we'll be answerable to each other and to the citizens, how that has impacted, right? How has this raised awareness in our communities against, you know, diabetes and hypertension? How has this, you know, reduced the loss to follow-up? How has this amount that's been invested sort of contributed to clinical outcomes? So I want to have even more discussions around that. So starting with understanding there's a key role, we have to come in the room ready to collaborate, but like tangibly, not just in words and on paper and in amazing concept notes, but tangibly, what does that look like? So let's take these solutions that we know have worked. We don't have to reinvent the wheels. Let's come into countries or in communities, listen to what the priorities are, and then align our resources. But let's be clear in the way we are approaching it. How will this contribute to clinical outcomes, improving them, and to various areas? So as I look forward to more collaborations and engaging with you, the audience, and engaging with more partners, that's what's at the top of mind.
Thank you so much. So again, evidence is key, right? Evidence is key to also start considering health as an investment, right? So that's an interesting question that I hope you can share some ideas with us on. Ilka, what is your take when you listen to all of this? Like, how can industry contribute to scaling up these initiatives and making sure they're much more integrated? As you say, there are proven solutions. So why would we reinvent the wheel in fragmented initiatives in every country over and over again? So what's your take on this?
Yeah, first of all, I totally agree. I mean, we need to work together, yeah, to basically grow our impact. And second, maybe just a bit of background how we work with our social startups. We have a model set up in which we start very early. It's incubation, acceleration, and investment. So we work with, up to now, it's 30 social startups over a long-term period. So it's a long-term period at which we provide technical expertise, funding, and connection. And by allowing basically an ecosystem to grow, it's very interesting how collaborations are built up and how complementary they are in addressing needs and delivering impact. So what we basically then do to expedite what's already there is trying to help and support and grow the partnerships which already are building up. And also on working with the public sector, maybe one nice, very tangible example, it's from one social startup, which will be basically a crystallization point for us to address a high need area in underserved countries. It's chronic kidney disease. On one hand, there's a lot of options and possibilities on prevention, yeah, which is definitely a gap. But if the condition actually is there, it's very, very difficult, yeah, because dialysis is really high need and not accessible. So there's one social startup which was able to bring it on the agenda of the government. Yeah, it has not been on the government agenda, but they basically approached the government and brought a potential solution which makes it more accessible, its peritoneal dialysis, on the agenda, and now with a voucher, basically the support, yeah, of the Canadian government, yeah, work with the university, with an academic partner on a solution, and if they achieve it, there will be a reimbursement, yeah? And so this is what I try to describe as our basically starting point. So now we identified many more young startups working on chronic diseases related to kidney diseases, and bringing them together and then basically connecting the dots to the government and the private sector. I think that's maybe the way.
Thank you so much. So it's really this bottom-up approach of nourishing early-stage founders, entrepreneurs, and bringing it together. Well, government leadership is leading, but also at the same time, it needs to be stimulated on, because there's so much going on and so promising. So thank you so much for these first answers. Maybe we should already give them a round of applause before we... we open up the floor to you, also keeping in mind the questions and on evidence. So I'd love to hear questions to the panelists and also some ideas. Two things, like, it's not a sales pitch, we're not in a Dragon's Den environment here, and stay nice, please. But maybe, as we said, physical inactivity has been declared a pandemic already in 2012, so maybe we should all stand up and stretch your legs for a bit, right? To get the blood flowing again. Oh, Gerald. Some squats, maybe? That's a step too far? Oh, I was just getting into it. So who would like to ask a question? I think you can sit down again or keep standing. I kind of like this, actually. Okay, I'll collect 2 questions and then, or 3 questions, and then you can answer.
Thank you. This is Mihigo from Rwanda. Thank you, Noela, for a great discussion. I also had a great chance to visit Boehringer recently with Making More Health, so it was really amazing. And I'm wondering, with this private-public partnership, how do we transfer these amazing skills to our next generation, maybe students in general? So I want you to make my job easier. I'm right now starting a job with University of Global Health Equity to come up with case studies of how we can teach our students, especially in this pandemic preparedness and response, but really specifically in public-private partnerships. So please, I would like to hear from you.
Thank you. So how can we engage students and train them in public-private partnership development? Keep that in mind. Next question. You can answer.
Hello, everyone. Hello, dear panelists. Thank you very much for your great speech. This is Kiandor. I'm one of the International Pharmaceutical Student Federation delegates, and I'm based in Iran. So my question that I really wanted to ask is that how much did you invest? Because this session was about the partnership, and it was about investment. How much did you invest in youth? Because we are currently 1.8 billion population in the world. And as much as you said, capacity building within the youth is very important. And, but we should have youth involved. And especially as Mr. Farouk mentioned that if within the pharmaceutical students, each patient is going to see doctor 1 point time within a year, but pharmacists 12 times each year. So how much pharmacists or young generation are involved within the public health? So that was my question, and thank you very much for your attention.
Thank you. To whom is the question? Or
I put my question on the table.
just put it on the table. Yes. So how do we involve youth? Yeah, because then I feel guilty about picking. You go ahead. Back.
Maybe we should start answer.
Well, one more. Just who do I need? Yeah, you.
Thank you very much. My name is Caterina Cardoso. I come from the International Federation of Medical Students Associations. So a bit of another question on youth, but a bit more general. We would like to know how, and again, for the entire panel, how can you ensure that these public, private, and NGO partnerships would be a source of sustainable and accessible healthcare for all, following the universal health coverage principles that we've been discussing so far, without excluding access to marginalized communities, especially in those less lucrative, more demanding areas that need so much more investment, but might not have that return. And even though we have recognized that health should be seen as an investment, how do you make that happen, and how do you overcome that barrier? Thank you.
Thank you so much. The voice of the youth is powerful, as it should be. So Noella, maybe you can answer the first question.
Thank you. I thought he was going to Elka. I would say the first and second question are a little bit linked. So I will link the student, teaching the students and investment in youth, not just in public-private partnership. I would say in general, it's, you mentioned use case, that's one tangible ways for students to learn, but the goal here is to identify and scale up the solutions that have been proven to work. So that should be part of the teachings. When we say we are improving the skill set, it's true that we focus on the healthcare professionals of today, but there's also the professionals of tomorrow, and so it's very instrumental to answer your question. So I know that everyone on this panel and many people in the audience are working towards this. So we are happy as I guess as a government agency to support as much as possible. Of course, you are raising the voice of academia as well, which is key. We're all products, one way or another, of academia. So that's another strong partnership. So that's how I would link, but happy to hear if others have
Thank you. Who would like to?
Maybe I'd just like to comment on this, because it's great to hear people enthusiastic about wanting to still have careers in healthcare with all the challenges.
Well, that in itself deserves
this
applause.
is fantastic. And I think one of the things that we're looking at when we work in partnerships to build training programs is we want to make these robust, sustainable training programs that are linked with universities, they're linked with medical faculties around the world, so that we take a true train-the-trainer approach. So when we put an expanded number of specialists into a country, or GPs or pharmacists, we want that training program to roll and multiply. It's really important that we engage on that. And I think one other thing that we've tried to devise as an organization, and this might sound a bit strange, but it's the other way around. What we're trying to do is get some of our younger talents and people who are interested in corporate social responsibility to be immersed into using their expertise within startup organizations, within ministries of health, where we can help with things like supply chain and so on. And you get a transversal sharing of skills and knowledge. And you raise the awareness within people who are working in larger organizations of what needs to be done in terms of the overall healthcare picture. And this is particularly with the younger generation. So it's about spreading the message about sustainability. It's about spreading the message about what you can do really with healthcare skills. So I think there's two sides to this for sure, from a private sector point of view, of a learning from what we can give and what we can get back. The get back is huge, believe it or not, it really is. But the youth is really crucially important. Ilke.
Youth, and maybe Farouk, because how do you involve the youth on a day-to-day basis in your work, right?
Yeah, so I think
young pharmacists.
Absolutely. I mean, I think we very early on recognize the role of pharmacists, right, and students particularly, because they go through their practice and they will practice one day. So, in fact, one of our largest audiences is students, and part of our view on that is that the school will teach you the technicalities of the work, but when it comes to the practicalities of the practice, that's really where we can help. So a lot of what we've done is actually launch, for example, training and facilitation for pharmacy students to help them to understand real life, real world settings. How do you interact with the customer? How do you manage your stock, inventory management, things that are very practical in nature that maybe not taught or are something that they'll only find out. The other aspect to that is we run actually one of the largest student internship programs where every year we actually bring on around 500 to 700 students to actually come work in our supply chain operations, work in our data and analytics, so on, to really get practical skills. So we very much think that if you are able to help this younger generation as they sort of enter the workforce, then they enter the workforce with all the skills that make them really the best pharmacists and therefore community healthcare workers that they can be.
Thank you so much. Really on-the-job practical training is crucial. Sami, you wanted to respond as well, right?
I just wanted to pick up on that question from, I think, International Federation of Medical Students. Did I get that right? Brilliant. I think it's a really important question around how do we make the economic case for reaching the last mile, recognizing that it might be more costly per beneficiary, so to speak, and that's kind of a language that we're trying to kind of shift away from, as a civil society kind of sector. I think it starts from understanding who these very marginalized people are and where they are, and I think there are lots of misconceptions about this. We have this idea that the last mile is kind of people and children who live in a very, very remote area, kind of 2 days away from a health center on the camel's back, right? And these situations do still exist, let's make no mistake about it, but they don't form the majority of people and children who are not accessing essential healthcare services. There was a landmark study that was co-authored by Gavi and the Gates Foundation recently. It showed that over 60% of children who are zero-dose children haven't received a single dose of vaccines. They didn't get their first dose of DTP. Live less than 2 hours away from a health center. So I think it starts by listening to people, listening to communities, listening to caregivers. What are the actual social, behavioral, environmental barriers they face to access services that in theory, and sometimes in reality, are literally on their doorstep. And that makes you realize that actually the cost issue isn't so much the issue. It's about understanding people's needs. It's about understanding the intersectionality of different forms of marginalization. And addressing them together with civil society organizations and by kind of putting communities first. And I think the cost issue, again, you immediately evacuate it and put investment back at the center of the narrative. So that would be my response to this.
Thank you so much. We have time for a few more questions. Sir, you're at the front. Sorry for those who are all the way at the back, because I don't see it that well.
Thank you very much. Rémi Vallet from UNICEF. My question was maybe in particular to Ilka and John, because you both explained that you're investing in also startups and supporting entrepreneurship. The question is, how do you identify these entrepreneurs? And how do you ensure, you were talking, John, about fragmentation. How do you ensure you select the right ones, or you work in a collaborative way that will not add to the fragmentation or to the creation of more vertical lines of treatment, but rather strengthen whole health systems? Thank you very much.
Good question. Remember that. John or Ilka, but I'm just going to collect another two. Otherwise, Gerald.
Thank you. I'm Gerald Laser. I'm working for KfW, and I'm in charge of our investments in health impact funds. And I have a question to you, John. You just briefly mentioned that Sanofi is also operating or managing an impact fund. I would like to hear a few words on that one. And also to you, Ilka, you mentioned your programs of supporting a handful or 30 of startups, but where is the link to your the public cooperation in it and accelerating that? Thank you.
Thank you. So how do we avoid the fragmentation? More about the impact funds, and what is the link to the public? Somewhere all the way at the back. Yes, very good.
Thank you very much, and thank you to the panelists. So my name is Anna, and I'm from Oxfam. Just a quick comment and a question. The first is a comment about the premise. There was lots of interesting questions at the start that I think maybe we don't all have the accurate answers to, but we're all familiar with the context. And I guess my comment is that the questions that were put up don't actually lead us necessarily to a foregone conclusion that private financing is the answer. We know that the WHO guidance to countries to achieve universal health coverage actually say to reduce reliance on private financing and increase public financing. So we need to address the barriers to public financing in order to realize the achievement of UHC. But my question is more related to the risks of public-private partnerships. We've heard a lot about the positives, but we also need to talk about the risks. And we've just conducted a massive investigation of nearly 400 investments made by development finance institutions into private healthcare in low and middle-income countries. And we have discovered a pattern of investment in very expensive facilities that are far out of reach for ordinary people, let alone low-income people. We've identified profiteering during COVID, and we've also discovered a huge range of very alarming human rights abuses, including the detention of patients in private hospitals who can't afford their bills. So my question is, can we talk more about the risks as well as the potential benefits? We need to be upfront about those risks, because if we don't address them, we could be causing more harm than good. Thank you.
Thank you. Can we talk about risk? Do you have someone in mind particularly you'd like to ask this question to, or is it just an open question?
It's an open question, but particularly for the representative from Rwanda and Save the Children, but for all the panel.
Thank you. So first, the question on how do you find investments and how do you avoid fragmentation? John or Ilka? Ilka, would you like to talk to that?
I can. Thank you. Well, how do we find investments? Of course, network partners with whom we work also together and with whom we co-invest. What we have started recently is to do call for actions on thematic areas. For example, we did one in animal health. And we selected 5 to 6 animal health startups. And when they start our journey on incubation acceleration, it takes like 6 months. and they all start to collaborate with each other, complement each other, and really begin tangible collaborations. So the next one we did is on chronic kidney diseases, and we see the very same pattern. Nearly all of them, by the way, have already addressed the public sector, the ministry. That's to your question, and that's for sure for us the next angle we will embark on, to connect more to the public sector, to the ministry, while the startups are already so agile and doing it.
Thank you so much.
So maybe to try and answer both your questions. We have a 25 million euro fund today, which we hope will grow. I have to say, asking for this in a large pharmaceutical company was 50% of people got it, 20% of people will never get it, and the others are, so there's an education piece going on here. But it's incredibly interesting as the agenda moves on healthcare and people become more behind this and they understand what we're trying to do. Bizarrely, there's a gap of understanding of how people communicate with each other. And many entrepreneurs and startups don't know how to approach organizations like ourselves, and we don't look like we're open for business well enough sometimes. And that's something we're working on. We're trying to do more. We're doing more calls for action. We're trying to look in specific areas where we feel there's a real gap, to your point, to try and avoid fragmentation. Where do we focus on particular areas on supply chain, patient data, digital areas? So we try to be quite targeted around what is going to make a quick impact and a real difference. We also want a mixed portfolio, which is quite interesting. We want everything from very early entrepreneurs, we might start with seed, up to people who are in levels of fairly decent commercialization that want to accelerate to the next level. And it's that blend that's really important. But it's more about promoting what we do, making ourselves open for business, and people see this. And I think many entrepreneurs as well are real entrepreneurs and have a great idea and they're going like crazy, and we have to sometimes sit down and help them with the business aspect, the more, how do we make this happen? How do we make sure the due diligence comes? So there's a real balance there of using our expertise. And the final part I would say that is becoming more and more important from whatever impact invest we're doing is the skill sets we have as a large organization that can accelerate a business's development. I'm talking about legal, regulatory skills, supply chain.
Very critical, the expertise that a company like Sanofi has. The question on risk, like, are we mindful of the risks of engaging in public-private partnership? Noella or Semi, who would like to address it?
He's pointing at me, so
Noella, it is.
I'll go first. So let me first take a step back and, yes, representative from Rwanda, but really from the perspective of what we're trying to do. First, on the comment of we do need to address barriers to public financing as well. I do agree with that comment that came up. Where is this amount coming from? Have we earmarked the amount that goes, say, to healthcare? How is it being used? How are the priorities being set? And so all that leads into accountability and also being linked to, is the amount having an impact, both from whether it's coming from the private sector partner or the public sector partner. So not a week ago, last month, I was in the parliament. You may ask, why was I in the parliament? I was being answerable in terms of mental health programs. What are you doing in terms of mental health programs? It was identified as a good setting, right? Should the money go towards, I think your example was infrastructure. Infrastructures are needed. However, we do need to ensure that it's, among the priorities and categories, whether you're growing the skill set, whether you're ensuring that the infrastructure is available. It's not bad to invest in an infrastructure, but it's how it's done. And that's certainly a risk that needs to be talked about. And so some of the ways, as I was mentioning, for me, I'm answerable to the parliament because these are funds. and there's no distinction between the funds that are from government sources to funds that are from external sources. I'm answerable regardless of what we're doing as an institution to addressing the burdens of non-communicable diseases, infectious diseases, and they go into details, right? They would have read audits around how we do our programs, and these are really, really tough 2-3 hour sessions. And the intent there is to be able to show how the amount was used. Was it equitable? Did it make sense the way we invested the resources that were available? What are we doing in terms of sustainability, right? It's not a one-off, here's something great that we did. It's more of, okay, now, how are we ensuring that it's going to be sustainable? Because the citizens are waiting. So just wanted to perhaps give it as an example. I'm not saying we have all the answers, but these are some of the ways that we've tried to address that.
I think you don't have all the answers, but you're answerable, right? So thank you very much.
Yeah, and just a few points to add. I mean, in response to, I think it was a great comment by my colleague from Oxfam, and I agree with all of it, but just a couple of comments. I mean, the situations you described in these private health facilities are dreadful. I've seen those in public health facilities. Women who give birth in the public health facility in DRC and don't pay the forfaitaire, are typically facing exactly the same situations. Same in Liberia. I've seen it with my own eyes. Women who had literally just given birth and were held hostage in the health facility. So it's not unique to private health facilities. Unfortunately, it is common across the board in countries with very low systems of accountability. And I think that's the common factor, and that's what we need to address. And it comes back to the strength of the public sector, the strength of the government. I think I said in my intervention earlier on, the private money cannot be a substitute for domestic resource mobilization. And there is a parallel session right now about kind of GFF, the Global Financing Facility, which is designed precisely to kind of inject cash and kind of support domestic resource mobilization. I think that the replenishment session will be very successful because we do need that. But nothing can replace that. It's got to be the engine for UHC. I suppose we take a pragmatic approach in places where we do believe that public, private, and NGO civil society partnerships can make a difference. Again, with the government as the engine and the senior partner.
Thank you very much. Very strong comments. We're almost at time, and when in Germany we are punctual, right? So I saw that there are many more questions, but of course you can ask them after this panel discussion. They actually walk around in the wild, so you can walk up to them. So maybe 30 seconds, last final remark. Ilka.
Last final remark. I think we see sectors emerging, and I think we see collaborations and partnerships emerging, and I think that's the way forward. Yeah, building the famous ecosystems across sectors and across diverse partners.
Thank you, Farouk.
Yeah, so I'll take this from the kind of entrepreneur's perspective. I think there is an unprecedented time window that probably opened up in the last 2-3 years, accelerated to COVID, where more funding, more innovation, more openness has been expressed by private and public sector to innovations in healthcare than ever before. So, if you have an idea, if you want to start something, now is as good a time to do it as any, and I think this is very, very unprecedented, what we're seeing. So take advantage of the window and, do some good in the world.
Thank you. John.
So we've been doing this for 2 years, and the opportunities out there are enormous. The will is out there to do this, and as Farouk's put, now is the time for action. We've got to do probably less talking and more action, really. And I think it terrifies me some days, the mountain we have to climb, but if we don't try and get up the mountain, we're not going to get anywhere, so we've really got to get going.
Time for action. Noella, final remark?
Yes, so I agree with more action. So as we leave here, let's think through, okay, now having reflected on the benefits of this type of collaboration between the public sector and various partners, and having reflected also on the risks, many of you are somehow working at the, intersecting with the challenges that we've talked about here. So now what? What are we going to take from here? So just to challenge us, we've reflected on many of these lessons, but let's take more actions.
Time for action again. Sammy.
Very similar. I mean, yes to public-private partnerships for health, but do please involve civil society right from the start and throughout. It doesn't need to be big INGO like Save the Children or Oxfam. It can be and should be also local civil society organizations, grassroots organizations. Listen to the people who are, facing those kind of social, behavioral, environmental determinants, because they will have the answers.
Thank you so much. Well, we've heard a lot. We've heard a lot about the importance of government leadership, about the importance of engaging civil society from the onset, the importance of also nourishing entrepreneurship that is there from the start, from the bottom up. We've heard about how we should also be mindful of the risk and should always look at evidence, right? Because evidence is badly needed to also convince private investors to step more into this place, because indeed, it can never be a substitute for public funding, but as the status is now, there's just not enough public financing, so it can be complementary. I think one conclusion we can draw from all of what we heard today is that health should be seen as an investment and not a cost, be it a public investment or a private investment. Health should be seen as an investment because it has the highest return on investment. Thank you so much for joining this panel discussion. And can I have a round of applause for our awesome panelists?